You know the normal anatomy of uterus. There is endometrium and myometrium. Two parts. Inside endometrium, outside myometrium. Endometrium consists of endometrial glands and stroma, and myometrium consists of muscle fibers. So, what is endometriosis? Endometriosis হলো যখন presence of ectopic endometrial glands and stroma outside the uterus. Uterus থাকলে normal, but outside the uterus থাকলে পরে ওটা abnormal. যখন endometrial glands and stroma outside the uterus থাকবে সেটা abnormal, তাকে বলা হয় endometriosis. It is the disease of predominantly reproductive age group and estrogen-dependent condition. Regress during pregnancy and after menopause. Why? Because at the time of pregnancy, which hormone increase? Which hormone increase at the time of pregnancy? Progesterone. Progesterone counteract the estrogen hormone. And after menopause, estrogen, action of estrogen will decrease. And genetic predisposition, KRAS gene mutation. If first degree relative has endometriosis, then there is 7 times increased risk. Site most common is ovary. Ovary is the most common site. Then uterine ligament, rectovaginal septum, cul-de-sac, pelvic peritoneum, serosa of the large and small bowel, and appendix, mucosa of cervix, vagina, fallopian tube, and laparostomy scar. Most common estrogenital site is sigmoid colon. Clinical presentation, chronic pelvic pain. It is the most common. Chronic pelvic pain. Then second most common, infertility. Then severe dyspareunia, pelvic mass. Pelvic mass due to ovarian cyst. Endometriosis, 3 types. Superficial peritoneal endometriosis, ovarian endometriosis, deep infiltrating endometriosis. Superficial and ovarian forms are commonly associated with malignancy, but deep infiltrating endometriosis rarely cause malignancy. Now, pathogenesis. 2 theories. Those that propose an origin from the uterine endometrium, another is outside uterus. Actually, there are 4 theories for pathogenesis of endometriosis. First is regurgitation theory. Propose that endometrial tissue implant at ectopic site via retrograde flow of menstrual endometrium. Menstrual flowটা retrograde হচ্ছে হয়ে through fallopian tube কোথায় আসছে first it is coming in the ovary. That's why ovary is the most common site. After ovary, it drops in the pouch of Douglas. What is pouch of Douglas? Space between uterus and rectum. And another site is uterosacral ligament. So, 3 common sites of endometriosis. First is ovary, second is pouch of Douglas, and third is uterosacral ligament. Another theory is benign metastasis theory. Here, distant site spread হচ্ছে via blood vessel and lymphatic channel. Example, bone, brain, lung. And then metaplastic theory suggests that endometrium arises directly from coelomic epithelium, mesothelium of pelvis or abdomen. Then extrauterine stem or progenitor cell theory propose that stem or progenitor cell from the bone marrow differentiate into endometrial tissue. Among these four theories, most important is Samson theory of retrograde menstruation and implantation. However, it cannot explain endometriosis in women who are amenorrheic because a variety of underlying etiology, endometriosis in the urogenital tract of men treated with high dose estrogen for prostate cancer and endometriosis in distant sites like brain, lung, bone. In addition, relatively low incidence of endometriosis, but in 90% women, retrograde menstruation occur, but relatively low incidence of endometriosis. That means there are another theory is present. That is molecular analysis. Release of pro-inflammatory and angiogenic factor including PGE2, IL-1 beta, TNF-alpha, IL-6 and increase estrogen and retinoic acid production by endometriotic stromal cell, due in large part to high level of T-steroidogenic enzyme aromatase. Aromatase enzyme কি করে? না অ্যান্ড্রোজেন থেকে ইস্ট্রোজেন কনভার্ট করে। So increased level of enzyme aromatase means increased level of estrogens, means increased incidence of endometriosis. Estrogen enhances the survival and persistence of endometriotic tissue, and mutation in tumor suppressor gene like KRAS, PIK3CA, PPR2, R1A. The significance of this mutation in cancer driver genes is unknown, but possibly contribute to the locally aggressive behavior of deeply infiltrating endometriosis. There is an association between endometriosis and ovarian cancer. Ovarian cancer, which type? Endometrioid and clear cell type. Consistent with this idea, in some instances, it has been shown that carcinoma harbor the same mutation as associated endometriosis in same patient. Means it is the driver mutation is the same for endometriosis and ovarian cancer. That's why in endometriosis patient, ovarian cancer occur because of driver mutation is same. Now morphology. Endometriotic lesion bleed periodically in response to both extrinsic and intrinsic hormone stimulation. This bleeding produces nodule with a red-blue to yellow-brown appearance. When lesions are widespread, organizing hemorrhage cause extensive fibrous adhesion between tube, ovary, and other structure, and obliterate the pulse of blood loss. Ovary may become markedly distorted by large cystic mass filled with brown fluid. That brown fluid, due to brown fluid, এখানে বলা হয় chocolate cyst. And the main pathogenesis is due to fibrosis and adhesion. The histologic diagnosis by endometrial tissue, presence of endometrial tissue means endometrial glands and stroma outside the uterus. It is a mucosa of colon. Colonic mucosa endometriosis also. These are endometrial glands, okay? And these are the stroma. And this is the normal colonic glands. This is the scar tissue. endometrial stroma, endometrial glands, and hemorrhage. তাহলে endometriosis means presence of endometrial glands and stroma outside the uterus. Most common signs of endometriosis are within the abdominal cavity. Several theories are there, like regurgitation, metaplasia, metastasis, stem cell origin, but among these, the most important is regurgitation theory. Clinical presentation: dysmenorrhea, pelvic pain, infertility. Peritoneal and ovarian endometriosis may be a precursor to endometrial carcinoma. Endometriosis is associated with anovulation. Anovulation means there will be no ovulation, but menstruation will. Anovulation means there will be no ovulation, but menstrual cycle will occur. Now, second part, endometrial hyperplasia. Okay. Endometrial hyperplasia is an important cause of abnormal bleeding and frequent precursor to the most common type of endometrial carcinoma. Endometrial hyperplasia থেকে endometrial carcinoma হয়, and endometriosis থেকে ovarian carcinoma হয়. And there is a similarity. What is the similarity? Both are estrogen-dependent condition, endometriosis and endometrial hyperplasia. It is defined as abnormal proliferation of the endometrial glands relative to stroma, resulting in an increased gland to stroma ratio when compared with the normal proliferative endometrium. Clinicopathologic and epidemiologic studies have pointed to the malignant potential of endometrial hyperplasia, and molecular studies have confirmed relationship between endometrial hyperplasia and carcinoma share specific acquired driver mutation. এখানেও same. Acquired driver mutation is same for endometrial hyperplasia and endometrial carcinoma. One is benign and one is malignant. But driver mutation is common and same. Endometrial hyperplasia is associated with prolonged estrogenic stimulation of the endometrium, which can be due to anovulation, increased estrogen production from endogenous source or exogenous estrogen. Now there are few conditions associated with endometrial hyperplasia. Obesity. What happens in obesity? Peripheral conversion of androgen to estrogen, and increased estrogen means endometrial hyperplasia, and increased incidence of endometrial hyperplasia means endometrial carcinoma, because sometimes it can occur from endometrial hyperplasia to endometrial carcinoma, not always but sometimes. Then menopause, polycystic ovarian syndrome, functioning granulosa cell tumor of the ovary, excessive ovarian cortical function, prolonged administration of estrogenic substance. That means increased estrogen. Now, why it is occurred? Inactivation of pecan tumor suppressor gene. Inactivation of the pecan tumor suppressor gene means PIK3 AKT pathway becomes overactive. It is overactive, PIK3 AKT pathway. And PIK3 AKT signaling increasing means, overactive means, it will send overactivity to the estrogen receptor. And that estrogen receptor will increase the function of estrogen-dependent cell like endometrial cell. Morphology. There is a classification given by World Health Organization. Hyperplasia without atypia and atypical hyperplasia or endometrial intraepithelial neoplasia. There are two types: hyperplasia without atypia and atypical hyperplasia. Hyperplasia without atypia কি করে চিনব? Increase gland to stroma ratio. The glands show variation in size and shape and may be dilated, and there may be back-to-back glands focally, some intervening stroma present. These lesions are caused by persistent estrogen stimulation and rarely progress to adenocarcinoma. It is hyperplasia without atypia, means here no atypical features will present in the cell. It is typical hyperplasia. This is the intervening stroma and these are glands. Typical glands, no atypia is present. এখানে কি হয়েছে না, এখানে ওভারক্রাউডিং হয়েছে, একটা গ্ল্যান্ডের পরেই আরেকটা গ্ল্যান্ড, ব্যাক টু ব্যাক গ্ল্যান্ড অ্যারেঞ্জমেন্ট, but psychological features are similar to proliferative endometrium. Now atypical hyperplasia. Complex pattern of proliferating glands display nuclear atypia. The glands are commonly back-to-back and often have complex outlines due to branching structure. ওখানেও back-to-back ছিল typically, কিন্তু এখানে back-to-back gland arrangement will be more and complex outline due to branching structure, মানে ওই গ্ল্যান্ডগুলোর মধ্যে ব্রাঞ্চিং থাকবে, more branching, more complex. তো এখানে কনফিউশন হতে পারে with carcinoma, endometrial carcinoma সঙ্গে confusion হতে পারে. Individual cells are rounded and lost the normal perpendicular orientation to the basement membrane. In addition, nuclei have open vesicular chromatin and conspicuous nuclei. Conspicuous nuclei means prominent nucleoli. Nuclei will be prominent, and open vesicular chromatin means there is every chance of confusion between atypical hyperplasia and endometrial carcinoma. The features of atypical hyperplasia have considerable overlap with those of well-differentiated endometrial adenocarcinoma, and accurate distinction from cancer may not be always possible without hysterectomy. ফার্স্টে কি হয় না, ফার্স্টে ওরা আমাদেরকে স্মল বায়োপসি করে পাঠায়, স্মল বায়োপসিতে কনফিউশন হতে পারে বিটুইন atypical hyperplasia and endometrial carcinoma. যখন ওরা আমাদের পুরো মাসটা পাঠাচ্ছে, পুরো হিস্টেরেক্টমি করে পাঠাচ্ছে ওরা, তখন ওইগুলো আমরা বুঝতে পারছি যে না, যেগুলো আমরা ছেড়েছিলাম atypical hyperplasia বলে, অ্যাকচুয়ালি দিস ইজ endometrial carcinoma, endometrial carcinoma. Indeed, up to 50% of women with diagnosis of atypical hyperplasia are found to have carcinoma when a hysterectomy is performed. After hysterectomy, diagnosis might be changed. This is the atypical hyperplasia with further increased glandular crowding. এখানে glandular crowdingটা অনেক বেড়ে গেছে and abnormal cytologic features. তাই জন্য একবারে দেখে মনে হতে পারে it may be a case of carcinoma, endometrial carcinoma. এখানে দেখো, এখানে prominent nucleoli, vesicular types of chromatin. Now, then, endometrial hyperplasia is defined as an increase in the number of glands relative to stroma, appreciated as crowded gland, most commonly caused by unopposed estrogen stimulation, and it is an important cause of abnormal vaginal bleeding. So similarity between these two, endometriosis and endometrial hyperplasia, almost same features, same clinical presentation. Both are due to hyperestrogenic state. It is divided into typical and atypical hyperplasia based on nuclear morphology. Atypical hyperplasia is associated with an increased risk of endometrial carcinoma. Pecan tumor suppression gene is mutated in approximately 20% of endometrial hyperplasia.